Hey everyone, it's Dr. Saguil, founder of Herbal 411, and today is more of a tutorial on how to take care of your asthma. So those of you who use inhalers, this is not an unboxing, but those of you who use inhalers, this should be familiar to you. This is albuterol. This is what all doctors, primary care or lung doctors, have been utilizing for, at least as far as I know, 25 to 30 years as a primary. So what this does is it relaxes the muscles around the tubes of the lung. So if you think of a snorkel that you use when you're going swimming, that long thing that connects to air and then it just extends into your mouth, into your lungs. Think of the tubes in your chest. There's a trachea that takes air from your mouth into the lung tissue, and then the trachea divides off into bronchi, both sides, and then smaller bronchioles, and then the alveolar sacs, and that's pretty much what makes up your lungs. When you take a deep breath, your diaphragm goes down, and it causes a negative pressure in your lungs, and if your mouth is open, the negative pressure, compared to the atmosphere, sucks oxygen or air into your lungs, and you exchange it for carbon dioxide, and that's the way we live. So the use of this thing has been great. And in fact, those of you who do use this, whether it's for exercise-induced asthma, or just with bronchitis, because some of you might have the attacks, but very seldom, except when you have a bronchus infection or a bronchitis or a pneumonia. At that point in time, then we use this thing. 2 puffs twice a day. I guess I might as well just open this thing up. And even if you don't know the name of this thing, this will probably look familiar to a lot of people. And usually what happens is this is a canister, and you can actually figure out how many squirts you have left by floating this. And if it floats like this, it's full. If it starts to float like this, or like this, it's half empty. And you put this in here. This is the mouthpiece. That's the mouthpiece that you put your mouth against. This is not mine, so I'm not going to put my lips to it, but you put your lips around the edge. And I can do this, you inhale after you squirt something. And I'll pretend I'm doing this. So that's what you're supposed to do, except you're supposed to be this way. You put your lips around the tube, you squirt it, the medicine comes out in a mist, you inhale that, and you hold it for as long as you can. Now hopefully those of you who do this can hold your breath for a long amount of time. The longer you hold your breath, the more the mist or atomized particles in medicine get to the very ends of the lung, which are the alveolar sacs, and that's where you can ensure that the medicine is doing its job, which is relaxing the smooth muscle that goes around the tubes, and it opens up the tubes. When you have asthma, it clamps down the tubes. That's why it feels like you're choking. You can't breathe because your tubes are collapsed, and breathing through a snorkel that's like the size of a straw is not going to help you when you're underwater. You'll have to breathe faster and suck the heck out of the straw. So you want a big tube, but you also want to make sure that you're moving air in and out of that big tube properly. So that's the basics of asthma. The problem that I see is that in the last 30 years, I mentioned that this has been the rescue. And there have been suggestions on inhaled corticosteroids. I don't have a sample of that. The protocol is made to use inhaled corticosteroids depending on how severe your asthma is, but always having this as your one go-to. Now, in 2006, out of a journal called Chest, which is Apex journal for lung disease and pulmonary specialists, there was an article that showed that the use of inhaled corticosteroids actually helped more so than this. So it used to be that people, and inhaled corticosteroids were expensive and rare, probably 2 decades ago, but the worry was that if you used inhaled corticosteroids, it could affect your hormonal HPA axis. That's already been proven not a problem. Maybe if you're a child or a developing kid, but that's why the pediatric lung specialists have slightly different protocols. But the bottom line was that in the 2006 article, they reviewed the use of inhaled corticosteroids along with a rescue inhaler and found that the people that used the combination they lived longer than the people that just use this to rescue all the time. The thinking back then was maybe the anti-inflammatory, which is an inhaled corticosteroid, changed around inflammation line to the lining of the lung. And maybe if you did just use this and you didn't want to change around the lining, that the lining would be resistant even to this eventually, which made sense. But patient compliance was always a problem because you'd have to use this, then you'd have to use a very expensive steroid inhaler, so nobody really followed it. The thing that was weird was that that's 2006. It is now 2024, and just the end of 2022, the beginning of 2023, there was a new protocol set by, it's called the GINA guidelines. GINA stands for Global Initiative of Asthma. And the GINA guidelines, which is a world group that helps people throughout the world not die of asthma, the GINA guidelines said this is no longer the primary inhaler. In fact, people who used steroid combinations where you have one inhaler has a steroid and it has a bronchodilator, those of you who know Symbicort, that's what they were studying. The people that use Symbicort actually lived longer than the people that used albuterol alone. My critique is that why did it take from 2006 to 2022, 23 to tell this information? I got something for you, but it doesn't matter. As long as the consensus is that it helps people more than usual, cool. Now, those of you who are my patients, I started following that paradigm shift in the fall. So any of you who called me for, hey, I can't breathe because my inhaler is in need, and what we usually do as primary care doctors, and the lung specialists do it too, is we give steroids, a burst of 5 days or 7 days of steroids orally, and that seems to calm down all the inflammation. But the data shows that if you do that once a year, wintertime, change of season, that is okay if you do it once. But a lot of people are doing it every year for decades. That's going to increase your chances for diabetes, weight gain, and osteoporosis. So you have to really be careful about how many steroid packs that you use, whether it's a Medrol dose pack or just 40 milligrams of prednisone straight. So if you use it for a rescue, fine. But the GINA guidelines say that you should use the Symbicort. I wish I had a sample of Symbicort, but it's too expensive. That's the other thing. So the GINA guidelines released in 2022-2023 said it's better for asthmatics to get inhaled corticosteroid bronchodilator combinations like Symbicort. Now that's actually covered by the government in Europe, not here. I'm not sure about Asia. Here it's $300 for that thing, so nobody's going to pay for that. I had to call in a substitute for a patient of mine. The only thing that the pharmacy had available, and this patient was going through a lot, was Advair. And she already had Advair 250 over 50. That means 250 milligrams of steroid, a certain type, and then 50 milligrams of a bronchodilator, certain type, long acting. But I said, okay, well, if we're going to follow the GINA guidelines, I need to give her more. So the suggestion was, what do you got, pharmacist lady? And the lady just said, well, we have 500 over 50. And I said, that's cool for me. If you don't have Symbicort, just give that, because the GINA guidelines say we should be rescuing with a dual inhaler. And that's called SMART. I'll tell you in a second what that means. So she gave it to my patient, and my patient got a bill for close to $300. Now we're trying to get that money back because the GINA guidelines are worldwide. The specialists in the U.S., the lung specialists in the U.S. are following the GINA guidelines, I think. And we're supposed to follow GINA guidelines. So number one, how are we going to do that when it's too expensive? We can't until somebody comes up with a cheaper version of an inhaled combination steroid and bronchodilator. Which just so happens, I got my new magazine today, This American Family Practice, and look at this. This is now being advertised. What is it? It's a combination steroid short-acting bronchodilator. Interesting. Why would the GINA guidelines come out after 2006 data now out of nowhere and change everything on its head? I don't know. Maybe a pharmaceutical industry company has something to do with that. Listen, I don't want to start rumors, but that's just coincidental that somebody's coming out with this now. And hopefully, whatever it is, whether you can get this paid for by your insurance company or you can get Symbicort paid for by your insurance company that the GINA guidelines are based on, I think the data is strong, that it has been strong since 2006, that if you decrease remodeling with a combination steroid inhaler, mild or moderate strength, and short-acting bronchodilator, and again, Symbicort's a slightly long-acting bronchodilator, but its onset of action is quick, that the data shows that you'll survive 30% greater survival than people using the good old rescue. You guys can decide, but if you're one of my patients and you're having the difficulty with breathing this time of year, I think there's a great use for combination inhalers. Single maintenance and reliever therapy, SMART. So that means one inhaler for both maintenance and relief, or rescue. They should have called it rescue. I don't know why they call it reliever. So anyway, that's the trend now. So if your insurance will cover this new thing that's being released, then just like Ozempic, even though it's being released and doctors are being pushed to sell it, you know it's not going to be available. So there's going to be a demand on this, but I think the data is good. The question is, why is the data so slow? Who knows? You can make your decisions, obviously. You know what I think. But so please use this if you have to. If you can't get that paid for as far as combination, Symbicort, then use this and a second inhaler that is a steroid inhaler. And you'll just have to do 2 puffs of this, 1 puff of this, and use it as needed, ad libitum. So if you need it 4 times to 5 times a day, that's what you can do it that way, both the albuterol and the steroid. So it sounds weird because usually steroids are only once a day to twice a day at most, but now we're going to be using it multiple times. Again, the data is strong. Always work on your lungs. The data did not say anything about exercise-induced asthma. So those of you who have EIA, I would still say use your rescue before you go to exercise. Like I tell all my patients, you have to do some form of exercise, you have to practice nutrition, you have to get some good sleep, and you have to practice mindfulness. But if you are an asthmatic, do 2 puffs, right, about 10 to 20 minutes before you exercise, and it'll help you. And one more thing, those of you who want to work on that diaphragm, to bring the diaphragm down and make that negative intrathoracic pressure to pull air in from the atmosphere, this is pretty cool. So this, I'm a big MMA fan, and Bas Rutten, I think you saw him on Here Comes the Boom, with Innovator, and he came up with this thing, and these resistance discs. This is essentially something that looks like a snorkel, if you think about it. Put it in your mouth like this. So all you do is suck in air through resistance, and the smaller the hole, the harder it is to suck in the air, and you hold it. Now, the idea with yoga and pranayama or breath work is to, when you bring air in, you pull the diaphragm down, but you extend the belly out. And in doing that, that's the proper way to breathe. But when you practice this, say 5 to 10 minutes a day, it gives you not only diaphragmatic strength, it also gives you some expansile proprioception for the chest muscles. And when you have intercostal muscles and diaphragm and your big muscles on the outside, the trapezius and shoulders, when you have them all working in unison, it does work to give you a better, it's called functional vital capacity, FVC. You don't have to talk about that stuff, but if you haven't seen a lung doctor to diagnose your asthma, you probably should have a spirometry, or we can do a peak flow. I'm going to leave that for another video, but in doing a spirometry, we check full volume, we check how fast you can get all your breath out in a second, and using those parameters is the way we figure exactly how severe your asthma is. And if it's bad, then we step up to the next treatment. If it's good and well controlled, we step down to the last treatment. So that's a little bit too detailed. I just wanted to talk about inhaler use. And for those of you who asked the question, why is everybody having bad asthma? The theory is that the masking has prevented a lot of us from experiencing typical allergens in the environment. And now we're super irritated to those environment allergens, whether it's mold, trees, which is usually going to be number 1, grasses, flowers, or dust and dust mites. That's why it's important to take care of your house. Vacuum, wet dust or static dust. Cover your sheets, encase the pillows in anything that's not going to absorb those bad things that you inhale all night and have an asthma attack. So think about how to best improve your lungs. I think this is cool. It's like $50 on Amazon. If not, then take a yoga class and learn from your yoga instructor how to work on pranayama or breath. And Those of you who are asthmatic and you don't have a good primary care doctor to give you the ideas of how to maximize or optimize your breath and get exercising, you can come see me. You probably should see a lung specialist, but I can usually take care of people before they get that detailed or that deep into the disease. Hopefully this gives you a couple of ideas. If you have an asthmatic relative, share this video with them and go over to my YouTube channel and think about subscribing as I do weeklies on how to be the best you can be. Thanks for watching.